What's going on, YouTube? I'm documenting my denture journey here. This is my second video. I just wanted to go over a few of the things I'm thinking about. I'm only 3 days away from my extraction date, which is Monday the 27th, January 27th, 2020. I'll be honest with you, I'm a little nervous, I'm a little apprehensive, and I think that that's all natural. But I've got to remember where I'm going to be after this is all said and done. And I'm going to have a better smile. I mean, look, these are terrible. It's one thing that I've grown up with over my 35 years of being alive, and that is the lack of confidence and lack of wanting to fully express myself, and smiling all the way. I've always been this kind of person, when I laugh or when I smile. Sometimes when I talk, it's hard to go on dates and not feel self-conscious about it. Now, you may be that person that's going to sit there and judge me and think that I didn't take care of myself and I deserve this, and I'll pray for you, because that's not the case. I had an accident. From my other videos, if you watched it, you'll see that I had a horrible work accident 11 years ago. And that changed my life, and it also just started developing a bone issue with me. Been on a lot of antibiotics lately, and those really do a number on me. Sorry. And what they have done is made me extremely weak lately, and I haven't been able to work as a result. So I'm praying that once this is all taken care of, and the healing process has started, things will get better. And I guarantee they will. But that doesn't shy away my anxiety right now. So I wanted you to know that you're not alone, because if you're looking at this video, you're probably wondering what that anxiety feels like. And for me, it's the fear of the unknown. Okay, I've had 5 major surgeries, so I know what it is like to be completely out and you wake up like that. You go out and they say goodbye, count down from 10 or whatever your doctor does. Then you wake up in the recovery room. That's what I've been reading, and I've been researching everything I can about this procedure. It's called IV sedation, and I've come to find out that it's similar, except for you're kind of conscious, and they can go up and down with your consciousness to the degree of surgical necessity that they deem appropriate. Now, a lot of people say they don't remember anything. I'm hoping that's the case with me, because I have 28 of my teeth that need to come out. It's not a small surgery. It's going to take a couple hours. But I'm the type of person that would rather blink and be over with it than sit there and be awake and hear it. Because another thing I've read and that I'm going to do is bring your own pair of headphones. Okay, headphones. Put your music on low when your procedure starts, if your doctor allows that, and play your favorite music. It'll help calm you down. The drugs that they're going to give you, it depends on the doctor. It could be propofol, it could be ketamine, it could be diazepam, it could be any of these things that are a mixture of, depending on your medical history. So, the biggest thing I'm taking out of this is I know everything is going to be okay, all right? And you're going to be okay if you're going through the same procedure. These dentists, they train years to do this, and they've had thousands, if not hundreds of thousands of people in your situation, and that's what this IV sedation is for. It's for people that are completely worried about the unknown. There should be no pain. In fact, there will not be any pain because of the local anesthetic they're going to shoot into your gums prior to your surgery. You probably won't even feel it, but if you do, you do. I mean, if you look at me, I have tattoos. I'm not obviously afraid of needles anymore, but I know that when I had my wisdom teeth pulled out about 10 years ago, I did conscious. I was wide awake, and they did the Novocaine, and they popped them out, and I had no problem. So this is a little different, I guess my biggest fear is an infection later if I don't take care of my mouth. Which could very well happen, and in that case, you should call your dentist or go to the ER and get that taken care of. But they do give you antibiotics once your surgery is done. So make sure you take all your antibiotics all the way through. Do not skip a dose or anything like that, because you don't want to end up with another infection. It's part of the reason I'm doing this is because I've had a lifelong issue with bone infections in my jaw from teeth that are just destroyed. I was on pain medicine when this accident happened, and I've had my struggles with those. That's another contributing factor to the reason why my teeth are bad, is because those types of medications can and will deteriorate your mouth. Dry mouth leads to cavities, and if you don't take care of yourself, it could get worse. If you're looking at this video and you're wondering if this is for you, I guarantee it's for you, because you wouldn't have clicked on it. You know, there's things in life that we want to find more knowledge about, and we look to others for experience and hope that they have some kind of something we can take from their video to ease their mind. And the best thing I can say is just let the process happen naturally. Try not to overthink things and take it one day at a time, because ultimately no amount of worry, no amount of stress, no amount of nothing is going to change what's inevitable. And what's inevitable is your teeth are just going to get pulled out of your gums, and they're going to suture them up, and you're going to heal, and you're going to have a new smile with, you know, immediates or perm dentures, whatever you decide to choose. So the light at the end of the tunnel shines brightest when you focus on it, you know, and that's something I've learned over the years. I can't be distracted by the darkness on the way to that tunnel light, and that's what a lot of people tend to do, and I've done it too. So I've also learned that while I'm worried, I'm focused. It's when I'm focusing on this problem is when I become super anxious and worried. So I've learned to take a walk. Simply just go take a block or 2 or 3 block walk. If you have an animal, go take them for a walk with you. Listen to your favorite music whenever you're feeling down. Watch a good movie and really get into it. Pay attention to the movie and not sit there and think about it. You got to distract your mind from these things, otherwise they're going to consume you. And you know, I'm going to document the day of, and I'm going to have a before and after video maybe of what I look like now, which is like, and when I actually get the immediates. That's what I chose, was immediate dentures, because I just is what I chose. So there's also the option of no immediates, and you can wait till you heal up to get your immediates or your perms. So there's all sorts of options. You just got to ask your dentist for these things. I'm not in no way a professional dentist. Don't take anything I have said in this video as stone, because I'm just sharing my experience with you guys. I do know one thing though. There is nothing that is going to mitigate the fact that this needs to be done. No avoiding the dentist, no canceling the appointment at the last minute. I've had a buddy or two had mentioned that, and that's just the fear and anxiety taking over. Don't let it. You've got to follow through with this. You've got to, you know, set up the appointment, get all the appointments in be on time, be early if you have to, and ask questions. That's another thing I've learned, is ask as many questions as you want. You're there for their service. You're paying them. You have every right to ask a question. And if you don't end up happy with your dentures at the end of the whole ordeal, make them remake it. Okay, all you gotta do is speak up. You know, the what's the saying? The squeaky wheel gets the grease. Well, that's totally the case here. If you don't say anything and you just say, okay, it'll be okay, or whatever, and you sign that paper for your dentures or your perms or whatever you're getting done, they're legally obligated, or yeah, they become legally obligated not to continue correcting any issues that you may have had. So be 110% sure that whatever you're getting done is, when you sign off, is 100% what you want. If it's crooked, tell them. If it's offset, crooked, or tell them. If the midline is off, tell them. If they hurt, tell them they can do adjustments, relines, soft relines. Just do not ever let a dentist bully you. Okay, you're there for them to pay. No, they are there for you, and you're paying them. So make sure you get exactly what you want. Everything's going to be all right, you know, and I guarantee it. And if it's not the end. You can always fix things. The best things about making mistakes is you can correct them. No matter how far down the scale you have gone, you can correct them. So just make sure you do your part, and everything will turn out fine. And until then, I'll catch you on the flip side.